Hi, I'm Kelsey. I work at Norton in Louisville, Kentucky. I will be presenting on congestive heart failure. I'll be referring to my patient as RS. RS is a 72-year-old Caucasian female who has come to the hospital as a direct admit from a primary care provider with an exacerbation of congestive heart failure. RS is retired from her career and is married with her husband and daughter at the bedside. RS's daughter went to her house to check on her, and she was having a very hard time breathing, had shortness of air, um, and she was crying, saying that she felt like she was drowning. She thought she was dying because she couldn't breathe, and told her that she'd been weighing herself and she had actually gained 40 pounds in a month and a half. So RS's daughter decided or talked her into going to her primary care provider. And once at the primary care provider, he admitted her. So I got her as a direct admit. RS has a past medical history of a MI in 1999. She's had 2 strokes, one in 2002 and the second was in 2005. A 15-year history of the congestive heart failure and type 2 diabetes. RS is a current everyday smoker of 1 pack a day for the past 55 years. When RS had her MI in 1999, she had an open heart surgery where they performed coronary artery bypass graft on her heart blockages. This past June, RS was actually admitted to the hospital for similar symptoms. She could not walk. She was having a lot of trouble walking. She couldn't bear the weight. Her legs were super swollen. And they actually discovered that she had stage 3 kidney disease and she was very anemic. So they treated that and they sent her on home. And now she came back. At home, she takes anticoagulant therapy. She's on Lasix, PL Lasix at home, and beta blockers. She has an extensive family history of heart disease. Her sister actually passed away in 1994 of heart disease. And she has 2 other sisters who have congestive heart failure after having heart attacks. When I got her, her blood pressure was slightly elevated at 158/92, and her heart rate was 62, respirations 22. They were very labored, shallow breathing. When you listen to them, you can hear the crackles of the pulmonary edema that she was experiencing. She weighed 280 pounds. She is an obese person, but she said her normal weight is 240. She also had jugular distension in her neck from the CHF. She stated that whenever she lay down in bed, she slept with 3 pillows because she always says that she feels like she drowns in the middle of the night. So lately she'd been sleeping in a recliner to keep her head more elevated so she'd get a little bit of rest. But it was so bad now that standing up didn't really even help. It was just, she just felt like she was drowning constantly. Her legs were very, they were like shiny. They had 3+ edema in them, pitting edema, and they were very, like, when you pushed on them, they hurt her really, really bad, and she just could not bear any weight. She couldn't even stand up on her own. And normally at home, she could get around with no assistance, so this was far from her baseline. So just a little pathophysiology on congestive heart failure. Heart failure is associated with the inability of the heart to empty itself adequately. This results in high venous filling pressure and decreased cardiac output. There are actually 2 types of congestive heart failure. There's left and right-sided heart failure. Left-sided heart failure is a result of ineffective left ventricular contractility. Blood that is not being pumped throughout the body because of the decreased cardiac output backs up in the left atrium and then into the pulmonary circulation. This causes the pulmonary congestion, the dyspnea, the activity intolerance, similar to what my patient RS was experiencing. Um, with continued pulmonary edema, right-sided heart failure does develop if it continues and isn't treated. With right-sided heart failure, the right ventricle has ineffective contractility, causing blood not to leave the ventricle correctly. The blood then backs up into the first atrium and then into the peripheral circulation, resulting in the weight gain and the fluid retention because the kidneys are not able to excrete the extra fluid that is left in the blood. When looking at both the right and left side heart failure, RS definitely has both right and left side of heart failure because she has both the dependent edema bilaterally in her legs. She has the kidney failure. She has the dyspnea. She felt like she was drowning constantly. So I would definitely say that she has both. There's a lot of risk factors for congestive heart failure. The number one risk factor is hypertension. And close to second is actually having an MI, which is what RS actually had. So her heart couldn't contract all the way, which led to the congestive heart failure. To determine typically if someone has congestive heart failure, it's more so a physical assessment because you want to listen to the lungs and you want to hear their background and you want to hear their history and everything to diagnose it, which is basically what they did with RS. He assessed her signs and her symptoms that she was presenting with. And like with congestive heart failure, typically daily weight. So you want to weigh yourself at the same time every day, which is what she was doing. And I guess she just didn't decide to act upon it until her daughter found out. And something else that can be done is an echo, which we did on RS, and it shows the ejection fraction. And whenever we did it on RS, the echo actually showed left ventricular hypertrophy, which is a result of her heart trying to compensate for the congestive heart failure. RS was treated at the hospital with IV Lasix every 8 hours. The Lasix being the diuretic, it moved the extra fluid from RS's body that was holding like around her lungs and her legs, and it helped it be excreted. But the one thing with the Lasix, and the physicians talked about, we had to really watch. We didn't want to dry her out too fast because she already had the stage 3 kidneys disease, so we wanted to monitor her kidneys really close to make sure we didn't dehydrate her too fast and cause further kidney damage. But all in all, RS had 2 consults actually added, because at our hospital you get hospitalists whenever you're admitted like that. She had a cardiologist and a nephrologist consulted onto her case. After talking to RS, kind of find out she had actually never seen a cardiologist since 1999 of her heart attack. She had only been going to her primary care provider, and he never really sent her to a cardiologist. He also is the one that found out about the stage 3 kidney disease and had never sent her to a nephrologist. So the hospitalist went ahead and consulted a cardiologist and a nephrologist. So she now has her primary care physician, a nephrologist, and a cardiologist that's seen her while she was in the hospital, and now she sees them outside of the hospital. Together, the cardiologist, the nephrologist, and the hospitalist really worked together to make sure it was a well-balanced treatment, to make sure that everything was taken care of for her. And all in all, she lost 15 pounds, which is awesome, in her 4-day admission. Her legs decreased to a 1+ pitting edema, You could actually like see the skin wasn't like the shiny tight skin anymore. She could walk normal again. Um, at discharge, they would be to tell her to continue her PO Lasix and to weigh herself daily at the same time every day and to stop smoking, to monitor her blood pressure and make sure it didn't get too high. She needed to eat a healthier diet, and she was to follow up with the cardiologist and the nephrologist in 2 weeks to continue to monitor her. But I have to say, I think that it all turned out really well for her, and it really showed me a lot that it takes more than just one physician to help a patient get better. It takes everybody, it takes a team of people to monitor somebody and make sure that they get back to their best self. And to me, it seemed like she was pretty much back to her baseline because she had explained that she'd always had edema in her legs, but it was never as bad as it was. But it made me pretty happy to see her be as bad as she was walking out by herself, not having to be wheeled out or anything. Thank you.